as you know, as you may be aware, we are stepping up on our testing as we step out of circuit breaker period. So as of 2nd of June, what we have done is, in stepping up testing, one of the priority areas is that for all students above 12 years old and all staff of schools, they will be, when they are presented to a doctor with symptoms, ARI symptoms, acute respiratory infection symptoms, they will be tested, PCR tests. So this is what we have been doing since the 2nd of June. So arising from this operation throughout this week, we have picked up 5 infection cases. So there are 4 students and 1 non-teaching staff. They come from 5 different schools, which is a clear indication this is not a cluster. All 5 have mild symptoms. In fact, when they were first detected, it was registered that the viral load is low. And so yesterday, all of them new samples were taken and they were retested. And the retested results showed that they all turned out to be negative. So actually, if today they are tested negative again, they can be discharged. But notwithstanding, they will be deemed as confirmed cases and will be reported in today's numbers. So MOHs, based on all this evidence, their assessment is that they are not likely to be infectious when they were currently or when they were in school. And the infection is most likely happened towards the end of the circuit breaker period and not while in school. And all of them developed symptoms Wednesday or earlier. When Wednesday was the second day of school opening. So based on all this, the assessment is that they have gotten their infection towards the end of the circuit breaker period and not while they are in school. But I'll let DMS comment on this further. So amongst all 5, 1 did not come to school because it wasn't his turn to come to school. The other 4 did. They came to school. While in school, they were well, they were masked up, and they observed all the safe distancing measures, and the different classes did not mingle or mingle to a very minimal extent. And based on this, we have done our contact tracing. About 30 staff and 100 students will be issued either leave of absence for 14 days or quarantine, and they will not be coming to school for the next 14 days. And all the classmates and staff who are on quarantine, they will be swabbed and tested before they serve their quarantine, and at the end of quarantine, they will be swabbed again. So that is to ensure that when they come back to school, they will all be safe and well. I just want to end my remarks with 2 things. One, which is as we step out of circuit breaker and try to lead life normally and engage in normal activities again, one is all of us must play our part, and particularly in the school environment. If you are sick, if any of your family members are sick, you are excused. Don't come to school because the risk of you bringing in a virus is a real one. Second is that as we have always said we will step up testing and we will have more rigorous contact tracing in order for us to step out of circuit breaker and lead life as normally as we can and conduct our daily activities. But as we do so, what it will also mean is that we will discover more cases. Because you step up testing, which is the current situation we are facing for schools. And I think it's important that we can detect these cases early, identify the close contacts, and quarantine them and trace them and quarantine them. Then the environment will be safer. But however, I think it's also very natural that when we see these extra cases, we actually feel less safe. And so although the actual reality is safer, we feel less safe. So this, I think, is part and parcel of living with COVID-19 as we step out of circuit breaker. And I hope it is a bit of a mental bridge that we gradually all have to try to cross so that we know that testing and discovering of cases is part and parcel of living with COVID-19.
The Ministry of Health was notified of several positive test results coming out from students and one non-teaching staff member from our public schools yesterday. And these were as a result of testing that was performed on the 4th of June. This was, as Minister Ong had elaborated just now, was part of the Ministry of Health's proactive surveillance. We had been putting together several additional initiatives over the last few weeks. This was in preparation for our coming out of the circuit breaker set of restrictions, moving into what we describe now as our phase 1. And we wanted to be sure that we were able to pick up as early as is possible any signs of community spread that might be occurring of COVID-19 infection in Singapore. So under these expanded new initiatives, it included proactively swab testing all students and teachers that presented to our general practitioner family physician clinics with acute respiratory infection symptoms. And this would include, for example, fever, cough, a running nose, a sore throat. And it was in this setting that these students and non-teaching staff had presented on the 4th of June to different general practitioners and had their swab tests performed. These tests turned out positive, with the test results coming out late on the 5th of June itself. They've all since been admitted into the hospital. They are all well, and they are making good progress in terms of the recovery. In terms of the onset of symptoms that all of them had, the earliest was in fact one of the students who had onset of symptoms recorded on the 31st of May. And this is well before school had started, during the circuit breaker period of time. The remaining students and non-teaching staff reported symptoms that started between the 2nd and the 4th of June. If we remember, it takes a while between the time a person is exposed to the virus to actually manifesting with symptoms, and this may be on average something between 4 and 6 days. It is highly likely that all of them had their exposure to the virus before the circuit breaker period ended, and then only after the circuit breaker period had ended did they manifest their symptoms. While in the hospital, we have carried out further tests, and we've also reviewed the original PCR test, swab test results. We noted that for all of these individuals, their original tests showed evidence of, in fact, of a very low viral load. And we can tell this by looking at various parameters, including what we call the cycle threshold or CT value. And typically, in an early infection, before a person starts to recover, when the virus is in fact present in high amounts in the body, this CT value often is very low. But as a person makes a recovery, and that recovery can be, in many cases, sometimes quite rapid and fast, the CT value progressively climbs and rises. And as the CT value climbs, the ability to be able to isolate the virus also correspondingly diminishes. We found in the various studies done by NCID that if you typically have a CT value more than 30, it is impossible to culture the virus in the body of patients. And this often is a threshold that we would use to signal that patients are no longer infectious. In all 5 students and non-teaching staff, their CT values were more than 30. And indeed, when they were admitted into hospital and the hospital repeated another PCR test, that PCR test was negative. So the second PCR test was negative. And this is in keeping with the fact that all of them are making a good recovery and in fact are clearing the virus very rapidly from their bodies already. We are planning to repeat that PCR test, and if that next PCR test turns out negative, we would then have 2 consecutive tests which are negative, performed more than 24 hours apart, and by a traditional way of determining whether a person is no longer infectious, they would in fact be safe to be discharged subsequently. We also performed other tests to look at how well they were combating the infection, and an early serology test had been performed. That test was negative, but it will only be a matter of time before even that test will turn positive. And this too would be a test that we can use for further follow-up. So in short, our impression is that these 5 individuals all had signs of a recent infection with COVID-19. It is difficult to determine exactly when it was that they were exposed, but based on when they developed the symptoms and based on the fact that the incubation period for this illness is at least 4 to 6 days, it is highly likely that all of them got infected before the circuit breaker period ended and only manifested their illness this previous week. They are all well, they're all making good recovery, and we are hopeful that we will be able to discharge them home very soon to complete their recovery at home. In the meantime, I understand that the Ministry of Education, in conjunction with the Ministry of Health, has taken various steps to safeguard the safety and welfare of other students, other teachers, other people who may have been in close contact with these 5 students and the non-teaching staff. These close contacts have been placed on either a quarantine or leave of absence, and we'll keep a close surveillance on all of them to make sure that they remain in good health and they do not get infected with COVID-19. This is a timely reminder as we report these cases that as we have moved out from the circuit breaker period of time, and we're now moving in our phase 1 of a careful resumption of services, it is important for all of us not to be complacent and to believe that just because in the previous weeks we've had a low incidence of community cases, that all is well and there's no possibility of any spread. Spread can still occur if we lose our vigilance, and it's important for all of us still to be disciplined in maintaining our safe distancing measures, to wear our masks in a very disciplined manner, to avoid unnecessary movements away from home or at work or in the schools, and to avoid situations where we would gather in crowds, and that increases the risk of spread occurring from an asymptomatic but infected person.